Hello, everyone. Welcome back to another episode of Brown People Problems, where I, Nikita, your host, chat with guests about what it really is about growing up brown and going through life while being brown. For today's episode, I have a really good friend and a lovely physician, Dr. Niyati Malkani. She is an old friend and she's a senior OBGYN resident in Saskatchewan in Canada. And she has a particular interest in global health and equitable access to healthcare, especially for Indigenous populations. And I'm so excited to have her on here and chat a little bit about women's sexuality, brown women's sexual health, and all of that good stuff that comes with that. So welcome, Niyati.
Thank you. Thank you so much. It's such an honor being here with you.
Yeah, I'm very excited to talk to you. When I was putting together all of my content, my ideas for this podcast, and I really wanted to do at least one episode on just what brown women's sexual education, sexual health looks like. And you're the first person that came to mind. And I thought,
Thank you.
gosh, I have to get Niyati on board with this. So I really appreciate you taking time out.
Thank you.
Yeah.
I'm excited.
Yeah, of course. Of course. There's so much to cover with this, but I
Yes.
just find that I think things are changing, and now there are more spaces for brown women to kind of get the right sort of education and really navigate their own sexuality and have more access to the right type of sexual health information. But I still think it's something that we don't speak about enough, whether it is culturally in our spaces, in our community spaces, or whether it is professionally as well in these larger circles. And I don't know if that's been your experience, but that certainly has been mine.
Yeah, absolutely. A lot of this is very historical, and there's a lot of things that you can't change, things that are taboo traditionally. And the other thing to keep in mind, and something I've noticed quite a bit in women's health, working in women's health in general, is that often women's health is not prioritized in even a family situation. So often we see these women who are older and are caregivers for their husbands or for their whole family, and their own health is so much so the last priority. So let alone talking about sexual health, talking about these things, it's just always on the back burner because the rest of your family has taken precedence, it's taken importance. And there is this cultural tendency, especially in South Asian cultures, to behave that way as well, right? The woman is the caregiver in the home and doesn't take care of herself. So there's a lot to uncover there. There's generations of stuff. So I don't know that it's something we can fix in really, but going forward, there's definitely changes we can make to kind of improve things for the generations that are coming.
Yeah, absolutely. Yeah, that's a really good point, right? That we can create safe spaces to have these conversations. But I think in order for people to want to access these spaces, there needs to be a bit of that mindset shift in the community where women start to put themselves, if not first, at least on the same level as they put everyone else.
Exactly. Yeah.
Yeah. I work in my work, and for our listeners who maybe don't know, I'm a psychotherapist. In my work, I often help people unpack some of these indirect, more subliminal kind of messages that women have internalized by observing other women in their families, right? Like the aunts and the moms putting out food for everyone else before they feed themselves.
Exactly.
Right. Giving the best share of the food, or I don't know, the best parts of the food to others before they get themselves.
Yeah.
And it's not like someone sits you down and says you matter less or put others first, even though that does happen, but it's more of just what we observe and what we pick up through how we see our elders model.
Absolutely. It's definitely that internalized learning, right? Like you learn from your role models and you see your aunts, your moms who are, respected and, praised for putting themselves on the back burner, and they've sacrificed so much. And we definitely internalize that in how we treat ourselves and our own bodies and our own health. There is that learning. So absolutely, exactly what you said, in terms of changing that narrative, changing that dialogue to make it better for the future generations.
Yeah, absolutely. It's just so glamorized, I think, and so romanticized, this role of self-sacrificer and that like
Absolutely.
silent suffering.
Mm-hmm.
It's such a big part of our culture. And there needs to be, yeah, like that mindset shift that, you know what, actually, I want to do things differently for us to even access what is readily available to us.
Yeah. It's also interesting. The other um, thing that's been noticeable with South Asian families that have now settled in North America is that there may be a slightly different approach to like healthcare in general in Asia versus in North America. And I can't really speak to exactly what happens in India because I've never worked there. But many of our patients like do seem to have a mindset of, you seek healthcare when there is an emergency problem. And even then you avoid until you really have to see somebody. And a lot of sexual health is about preventative care. Right? And that's a whole other mindset that you're not like that needs to be learned. It needs to be normalized, that there is a whole aspect to our health and that it's preventative care, and we can actually prevent a lot of these problems rather than trying to chase them down when they're kind of far along. So that's another mindset thing that I think for our future generations would be very helpful to.
We as a group, as like a larger group, we are so reactive with our health, like so reactive. Like, and I think a lot of it has to do with like with the colonial trauma as well, right? There's a general mistrust of Western medicine. We know that a lot of BIPOC individuals, Black and Brown people, were taken for experimentation during World War II. And so there's so much intergenerational trauma there.
Especially in gynecology.
Yeah, I think that is just, that's so unfortunate, right?
Yeah.
And it becomes, that fear becomes so kind of learned and becomes so much like a part of us, which is why I think, especially Brown people, right? We kind of go to homeopathy. Is that how you pronounce it? Homeopathy, right?
Yeah.
Before kind of like the Western medicine,
Yeah.
because there's just a general mistrust. And like you said, sexual health is all about preventative measures. And if we don't have that mindset, then we're not likely to engage in that.
Exactly. So I think something that's, very helpful is that through podcasts like this, through interventions like this, people like the conversation is opening, and we are normalizing this type of conversation, and it's becoming more normalized in non-South Asian demographics of our generation. So hopefully as we, are exposed to all of these things, it does open the door for South Asian women to really pursue these avenues of information, to be self-empowered and go get that information, even if it's not necessarily being discussed at home.
Yeah, and I think that change is so like has to be really fundamental too, right? Because I think about even just like our biology, and I think I was in my mid-20s when I learned the right names for all the different parts of me, right? Like we just
and most patients we see have like no idea. Like we call everything the vagina. It's not. It's really not. It's called the vulva, by the way.
Yeah, right. Absolutely. I think I actually started reading this book, and I'm looking at it right now, and I can link it for our listeners if they're interested. But it's called Come As You Are. And it's all about, I'm forgetting the author's name, but it's all about really kind of tapping into like your sexual pleasure, your sexual desires, and learning to really kind of befriend your anatomy. And it really kind of demystifies everything around
all of these things. Absolutely.
Yeah, because there's so much mystery around it. We don't have the right language that's provided to us. People turn to the wrong sources like pornography, or like, I don't know, Reddit threads, and they're too shy to talk to their doctors about it. The doctors are too awkward to have a conversation about this.
Very often. Yeah, correct. Speaking of labeling of parts of the anatomy and normalizing what different vulvas look like, it's a huge thing as well. Like we see women who have come requesting major surgeries on their vulva for normal vulva. Like everyone looks different. Everyone has it's all normal anatomy, but they feel like there's something wrong with them because of what they've seen, usually in porn or on social media or movies, of what is supposed to be normal. But that range of normal is so big, and I have never met someone that actually has a medically indicated need for that, right? So I can only imagine that internal like feelings of shame or guilt that you must feel about your own body, not knowing what is normal because it's not talked about and because it's not shown. And rarely even moms bringing their daughters for that. So, and not realizing the long-term harms that can come of it. So there are a lot of major issues that still, and we see it every day in this space of care, where that internalized shame and guilt is, we see it every day. So absolutely opening those doors for conversation and showing what's normal, learning what our parts look like, what they're called. It's so important.
Yeah, I think that education piece is so central, because if you don't know, if you're not familiar with your own body, you are less likely to ask for help. You're less likely
Absolutely.
to ask for your needs in a sexual relationship. You are less likely to know when something is wrong. You're less likely to seek medical attention. So that it all starts with just education and that like embracing of our bodies.
Absolutely.
Yeah. I and I have some thoughts too, I think, on how like the medical system can be a little bit more receptive to that change. But I remember this conversation I had with my family doctor. Gosh, I was I don't know, 17 or 18, and it was a brown family doctor. And she asked me if I was sexually active in front of my mom, who was, you know, right there.
Not appropriate. Yeah.
Yeah. And it wasn't even a, are you sexually active? It was a, you're not sexually active, right? Okay. So
the exact same thing happened to me, by the way, with in front of my mom, 16, 17.
Yeah.
You're not sexually active, right? Yeah.
Yeah.
South Asian family physician.
Right. Yeah. And I think, yeah, that for me for years, I think sort of like closed the door on a lot of this conversation, where medical spaces didn't feel safe. And it wasn't until in my mid-20s, I think, that I had like my first pap smear. And I remember like so much anxiety around it too, that, you know, what is my doctor going to ask me? What is going to happen? What if like there's something that comes out of this, right? And I think I really had to coach myself through, okay, this is a normal experience. This is a necessary thing to go through. And this person is here for my care, for my benefit. And as a consumer of healthcare, I have the power to ask for comfort, right? So I think it takes a lot of coaching, and not everyone has the bandwidth to do that work as well.
I totally agree. It is the responsibility of the care provider to be able to open that conversation, especially when it comes to things like pap smears and preventative health, and to really get a proper sexual history from a teenager. You can't do that in the presence of a parent, right? And these are all things that are now starting to show light in medical curricula in North America. Like our program, for example, had an excellent talk on sexual health, like a formal academic half day taught by a specialist purely on this subject matter, everything from the cultural influences to the anatomy. It was fantastic. But I believe it was either this year or last year that it was the first time that our program, which is a very contemporary Canadian excellent program in obstetrics and gynecology, has brought this in formally. And even in medical school, like excellent medical schools in North America, limited conversation on these things. So I think now that these changes are starting to happen, hopefully we will see a generation of physicians that are able to have these conversations. But certainly, I don't think it's common, unfortunately, enough. Like, I don't think enough providers are comfortable having these conversations today. And it certainly contributed to some of the misinformation, because then what will patients do? You'll turn to social media, you'll turn to sources that aren't accurate, that sometimes profit off misinformation. So it's very challenging, and absolutely the medical field needs to evolve. I think it is evolving, and that we will see some changes, but certainly it's not commonplace enough yet.
And that, combined with our attitude towards healthcare as a cultural group, right? I think that just creates this like lovely like ball of like mess. And that's a lot to work through. And in today's economy, for our generation, it's hard for us to afford a home, the rising cost of everything, inflation, everything else with your health and mental health like takes a backseat.
Absolutely. You're always going to focus on the things that need immediate attention, as opposed to prevent things from happening in the future, right? So right now I'm on a rotation in gynecology, oncology. So that's where we see all the
Mm.
gynecological cancers. And what is the most common reason that women present with cervical cancer? It's not being involved in a screening program is a huge risk factor for that. And it's life changing. It changes your body image, your, sometimes self-worth. It's terrifying, but it's preventative. It's one of the most preventative cancers in the world because of the screening programs. And many women that have immigrated or have other life stressors, social stressors, don't engage in that preventative care and are therefore at inherently higher risk of these terrible things happening, or they seek care later when things are further along. And so your options are more limited. So all of these, discussions that aren't being had, all of this putting your own health on the back burner, it actually has very severe lifelong consequences that we don't necessarily all realize until you know someone that's gone through it or seen it firsthand. And you can't know unless the conversation's opened or that your primary healthcare physician tells you, right?
Yeah, absolutely. And I know that in like a lot of marginalized communities, the Indigenous population, the South Asian population, there is so much of that like intergenerational trauma, colonial trauma, right? Cultural trauma, that makes us also more susceptible. We have all the risk factors for a lot of this stuff. And our mental health is compromised as a result. Immigration trauma, acculturation stress, all these things add on. These can be some of the smaller quote unquote traumas, but they still impact the body.
Absolutely.
Right. And if we're just so busy making ends meet on a day-to-day basis, right, making rent and putting food on the table for your kids as an immigrant parent, you are not going to go to your family doctor for a physical every 6 months.
You're not going to go get your PAP.
No, you're not going to go get your PAP. You're not going to go for your mammogram. You're not going to, it's just not on the table.
Yeah, absolutely. It's actually devastating. And now I think that we're getting to that age where we see more of our friends and family members suffering from the consequences of that. It highlights even more that this is a desperate need, that we need to talk about these things. It needs to be normalized and we need to prioritize ourselves.
And I sometimes think about how much like shame and secrecy there is around women's sexual health, especially in like our brown families. And I don't know if you're comfortable sharing, because I often reflect on my experience, right? Not having access to information and just like this thing like a taboo topic. We're constantly taught to be really cognizant of our bodies and how our bodies are showing, how we're sitting, how we're attracting attention, that it just creates this whole bubble of like secrecy and shame around talking about our bodies. Feels like a dirty topic.
Absolutely. I'm actually quite lucky in that I grew up in a home that was very open to these conversations and that I could talk to my own mother about anything. But certainly the things about, hiding your body and not talking about it in public, that is certainly something that, is quite prevalent. I know not many people have that luxury, though, to talk with their parents or with their sisters or siblings or whoever. And I see that every day at work, where even now women who have cancers of their gynecological organs cannot talk to their friends or family and have said that they feel like they have no support and no one they can talk to, because you don't talk about your lady parts to anybody, right? And you've grown up not being able to do that. And now that you really need that support system, you don't know how to seek it. When we say words like vulva and vagina to people, the shock sometimes that you can see on their face, like these are not words we use, but we use it every day, especially in the clinical setting, where you see people's partners leave the room because they just can't hear the words that we're saying. So, like, I see it all the time. It's very much an issue, and I can see how people who need to have this conversation and can't with their loved ones can certainly suffer and long term.
My mom gave me my sex talk in an elevator. Brief, and she's gonna listen to this, and I'm gonna get a text from her as soon as she listens to this. But I got my sex talk in an elevator from the lobby up to our apartment. And obviously,
Quick
this is
and
not
dirty
the kind of
information. That's all you need to know.
yeah, exactly, just like the basics.
Mm,
But obviously we don't also want to put a lot of blame onto like our parents, like
of course.
generation.
Mm-hmm.
There's so much that they kind of had to go through, and it's their own discomfort around having these
Yeah.
conversations as well. So it's not to place blame anywhere, but
No.
I
There's
often think
social
about
reasons, like the, cultural reasons, social reasons, economic
yeah,
reasons, like that have, it's centuries old. Like this is not any one person's fault. It can't be.
no, no.
No.
And I often, think about how conversations around consent are also
Mhm.
missing, right, in our community. So not just teaching girls consent, but teaching boys consent. And because, again, most of us haven't had those conversations, we find ourselves in abusive relationships, or we find ourselves in situations where we feel that something is wrong here
Mhm.
by having given consent, but
Yeah.
we are not able to access the language to say
Mhm.
no, and we feel guilt tripped into performing sexually in ways that we may not feel comfortable as women.
Or you don't feel that you have the right to say no because as a
Mm,
spouse, it is your duty to be present sexually for your male partner, right? Like sometimes that cultural attitude has been around for a long time, that that's your duty and that's what you do, and you just shut up and take it, right? Somebody once told me, somebody older who I respect, a role model, a family member, said that it's not rape if you pretend to enjoy it.
oof.
And how traumatizing is that to hear, right? As a young person, but it's an attitude that's there. It's your duty as a woman, and it's so damaging.
Yeah.
How can we actually stand up and say no when we mean no?
Mhm.
So there's so many layers to that
Yeah.
that need to be unpacked. And you're right, accessing that language and the confidence as well, and knowing that you have the right to say no, understanding that right. And it's hard because you hear that in the public space, but you may not be hearing that at home.
Mhm.
So that's another thing to be aware of.
Right. It's all just so layered. Um, And I think a lot of it just has to start with that shift, like culturally,
Yeah.
to be able to talk about these things, to even if it's uncomfortable, talk
Yeah.
about it, right?
Mm-hmm.
Talk about it with trusted people, talk about with trusted family members, trusted friends,
Mm-hmm.
engage in learning like this that is available online. Because I think at the end of the day, we are sort of the gatekeepers of our own health. We have to take charge. We cannot just go through life passively
Yeah.
and just putting out fires as they come. Thanks to the sacrifices of our parents and immigrant parents, we are in a position of privilege.
Absolutely.
And our position of privilege, we have to use it well. We have to use it to better inform ourselves. We have to use it to holistically lead a better life, not just financially, economically, but
Yeah.
really taking charge of our mental health. And whenever, even if it's just me going to the doctor or my partner going to the doctor, I always have like a pep talk, and I'm like, okay, how are you going to advocate for yourself?
Mm-hmm.
Because we also know family physicians, and they have a lot of burdens and stuff, but they're also notorious for just like shooing you out the door, right?
Yeah.
Very quickly.
Mm-hmm.
And that's the unfortunate circumstance of the system of our healthcare.
Healthcare
But
system is a whole other conversation, but
oh,
yes. Yeah.
absolutely. But I have like a pep talk with my partner every time. Like, okay, what are you gonna ask? What are your questions? How are you gonna advocate for
Yeah.
yourself? If
Yeah.
your doctor is like getting out of their chair, what are you gonna say? Are you gonna say, sorry, one more question, right? I
Yeah.
think we need to have these conversations.
Yeah.
They're
We take charge of
important.
our own health. But at the end of the day, you're right. We have that responsibility to be, to be in charge of our own health and our own well-being, and to take these privileges that were afforded to us by our parents who have sacrificed, and do better for ourselves and for our kids in the future, should we decide to have them.
I know we've kind of touched on this already, but I wonder if in your academic experience, personal experience, professional experiences, have you noticed something particular about the brown women as a group and about their attitudes and beliefs around sexual health that you think are like serve as additional barriers for us?
Right. I do hate to make general comments about groups, but that being said, there are certain trends that I've noticed in women from South Asia who have immigrated, especially those who have immigrated recently, there certainly is, like, for example, there certainly is a very obvious tendency to just agree with what a physician recommends. There's hardly ever any self-advocacy. There's a lot of deferring to the male partner in the room to make any decisions, or allowing, sometimes I've even seen in-laws make decisions for a South Asian patient who decides that, oh, they will decide. Like, it's her intimate gynecological exam, it's her intimate healthcare, it's her childbirth. However, the decisions are being deferred to male partners or in-laws. There's hardly ever any asking for help. It's a lot of complying with whatever is asked of them from physicians or from nurses. And it's quite heartbreaking, actually, that there isn't that ability or confidence to ask for what you need and ask for what you want. There's also, I have noticed, a lot more, like a disproportionately higher amount of anxiety coming into a place like labor and delivery. It's already an unfamiliar surrounding, and given all the other stressors that we've talked about, we biologically know that increased stress does negatively impact your labor and your childbirth experience. It's a known medical fact, and that's why pain relief is so important. It's an integral part of the childbirth process. But when you come with that heightened level of anxiety and fear, those same hormones, like that same adrenaline, is impacting you physiologically. So certainly there are definite tangible, like, medical impacts of all of this, like, generational trauma and cultural trauma that we're seeing in something as intimate as childbirth. So
yeah, I mean, if we're not even taught to see our bodies as our own,
absolutely,
then no wonder we're deferring decisions about our bodies to others.
Absolutely.
Yeah.
There's definitely certain, like, cultural beliefs about things like pregnancy that have, they have likely their origin in like things from back in the day or from different types of knowledge that has now evolved, and we know better some risks and some benefits of things, but those cultural attitudes are sometimes hard to change, like bed rest, which is dangerous, however very commonly thought to be important culturally during pregnancy. It's a small example of how these things can conflict, like what is Western medical knowledge versus what is cultural belief. And it probably makes it hard for the patients too, right? Like, who do you believe? Do you believe your physician? Do you believe your in-laws? How do you take the advice you get in your doctor's office home when the advice there is conflicting and you may be shamed because maybe your body isn't your own? You're carrying the first grandson, maybe, right? So there's all those layers to unpack that can sometimes make people, providers, who are not familiar with who are not sensitive to those cultural changes, they may feel it harder to care for those patients as well. And it further damages that provider-patient relationship, further worse care. It's like this downward spiral that is so, like, everyone's at a risk of that, given all of these different things. I'm not saying this happens with everybody, but you can see how all these different layers can really negatively impact someone's experience with the healthcare system and with something as big as childbirth.
Gosh, I didn't even think about that, but I think that makes a lot of sense. And and as you were saying that, I think about how whenever I see pregnant women jogging, right, with like a running belt like around their waist, and they're jogging and they're running, and I know rationally, intellectually in my mind that physical exercise is good for you when you're pregnant. But then there's this like older, feels like a more cultural learning that's just like embedded in there that is, oh my God, what are you doing? Shouldn't you be resting?
Yep.
Right? And I think for maybe those of us who are having these conversations, and for those of us who are doing the work, we can really feel this like push and pull between these two parts of us.
What like in your left brain and versus what like what you've learned at home and what you've seen throughout your whole life. Like, how do you separate those things? Especially, I think it's especially important in women's health because it's so like emotional like it's so emotional, it's so personal, it's so internalized. And when it comes to building families, it's, often women feel it's not about themselves, it's about their whole family. So it's a challenging area of health as well.
Is there, would you say, maybe not sufficient, that's a very subjective term too, but is there, in academic institutions, is there a focus on navigating a patient's like cultural attitudes and identities in your training as a physician?
So we are lucky that we do have like a diverse population where I'm training. And so you do have to certainly acknowledge all of those things. And, because ultimately the healthcare you provide, it's not just medical information. Yes, you have to provide that information that we have, like our best available evidence for whatever it may be. But then you have to use that information with the patient's values, their social situation, their other stressors, put that together to make any decision, right? And certainly we've had formalized training for some of the populations that are more prominent in this area to get a little bit more insight into previous generational traumas and find the resources to help us navigate that. But I would not say I've had that training with South Asian populations in particular. That being said, where I train it is a minority, like that group is a minority. I can't speak to where there are a higher demographic of South Asian women. So potentially.
Yeah, I think as healthcare providers and as people in this field, I think we have to be able to observe and be aware of and talk about all of these different intersections, right, of our identities. How does our culture intersect with our mental health? How does our culture intersect with our attitudes around our physical health? And until we talk about them, until we explore them, we can't really understand how this person is going to take charge of their health or not.
Yeah. There's just so many layers to unpack. And I think, opening this conversation and making it more acceptable to talk about with our friends, social media has been huge. And I think there's a lots of potential to do good there. There's potential for harm, but there's also potential for great information dissemination. And having that access, I think, can really kind of revolutionize the conversation going forward.
Yeah, absolutely. That's sort of my hope as well.
Yeah, absolutely.
Right? Yeah, just largely. And I think whenever it feels uncomfortable to talk about some of this stuff, what I find is helpful is to acknowledge that discomfort and then still like push through it, right?
Absolutely.
The discomfort is super normal, not because we're talking about something that shouldn't be talked about, but it's because we've been taught to believe that this is uncomfortable. Right?
Yeah.
So it's not objectively true, it feels subjectively true. So we kind of have to acknowledge that, but then still kind of push through it and say, okay, you know what? I am going to go for that, like pap smear. I am going to talk to my doctor about whatever, this little thing that I see, right? Like on my body, like we have to push through that discomfort.
Absolutely. It's so critical to not only your immediate well-being, but your future well-being. And if that attitude is certainly there, that we need to be the caregivers for our family, but one of the best ways to care for your kids, your loved ones, is to actually make sure you're okay and make sure you're around and that you're well so that you're able to be there for them. And if we can foster that mindset, then I think it could certainly make a positive difference and maybe help people pay more attention to their own health and well-being.
Yeah, absolutely. And if it's hard, I think, to find spaces in our personal lives for these conversations, I use this app called Flow to keep track of my cycle. And they have this secret chats section, and they have like a lot of they have a lot of like chat services and these like forums and information that are monitored, I think, by sexual health professionals. So make sure there's no wrong misinformation. And it's so lovely. You can kind of use that platform to talk about it. And I remember once they published an article about different types of discharge in month and in your cycle, and what does that mean? And I remember I was like, I think like 27 or 28, and I was like, holy crap, like this is never something that I had to thought about before.
Yeah.
And it's something that happens every month
Yeah.
in my body. What do you mean different types of discharge? And I like
Never thought
that
of
article.
that.
Never thought of it. And I had read
Yeah.
through the article, and I remember I felt like a different part of me was like awoken that day. I was like, wow.
Learn about your discharge.
There's so much that I don't know about my body.
Yeah, there's a lot we don't know, and there's some excellent resources out there. I think one of the challenges we're going to face as a generation and those younger than us is finding the right information. Because where there is abundancy, there's also lots of space for misinformation. And I do find that that is particularly common in the space of women's health. So knowing your resources when looking at that information, which we all do, we all look things up all the time, but looking at your sources and where that information is coming from and making sure that people aren't profiting off the information that is being shared, I think is critical, because there's a lot of potential for that exploitation. It's always done in vulnerable populations. Women are vulnerable, South Asian women are vulnerable. So just something that I think our audience should be very cognizant of when they're looking for information.
That's a really good point. Yeah, thank you for sharing that. That makes a lot of sense. So we also have this duty to make sure what we're engaging in is true.
Yeah.
And it's reputable and credible information.
Absolutely. Yeah.
Absolutely. I think about often how, we can help foster a more confident and comfortable next generation of brown women who are better informed and educated. And maybe I don't know, too much of an activist, but I think about how in my family, if I ever see someone, telling a little girl, be like, oh, go give uncle a hug, and you're kind of seeing the kid just stand there, I'm the one who to say no. You're not gonna go give any random uncle a hug,
that you don't want to. Yes,
exactly. You do what you want to do, right? And if you want to give him a hug, you give him a hug. If you don't have to. So that's sort of my micro way of kind of really kind of standing up. But in your opinion, what do you think are some of the things that we need to do?
I don't actually think that's micro in any way. I think that's fantastic. It's all these little things that add up, right? It's that exactly what you said before, that inherent learning, like we learn by seeing things and internalizing that. And even that example that you set for that little girl, I'm sure has carried her forward. So I think at the end of the day, we all just have to be very conscious of the things we say and do, especially in this field. And especially if you are somebody that has some sort of influence, someone like us, we've trained in these areas, and what you say actually goes a very long way with young, impressionable children. So I have every plan to talk openly about sexual health with my children, regardless of their sex, from a young age. We call body parts what we call them by their anatomical name, right? And I think it's just setting that example from day one with everybody, talking about it with our moms and our aunts, with young cousins, with friends, just those of us who do feel like we can have those conversations, actually having them, using the word vagina without flinching, using it more commonly. I say it to my fathers, to my uncles, because that's what I'm studying. That's in my textbooks. So it's part of your anatomy. It's all those small changes that I think we need to make consistently, that work on normalizing things, right? And I actually think all of that cumulatively will make a really big difference.
Yeah, absolutely. I think I even think about how there's some sort of change happening in Bollywood, right, where there's like a lot of more movies like around sexual health. Yeah, I mean, they're not perfect. Still, like the language around it's very clinical. There isn't too much of a focus on the pleasure aspects of like a woman's like sexuality and sexual health. But there is some sort of, like a change coming. And I find that whenever someone asks me for a movie recommendation, I'll sort of offer these movies with like social messages and say, oh, have you seen that movie called Lust Stories? It's great because it actually like has all these amazing short stories about women exploring like sexual pleasure. Because I think we need to be able to see this stuff as well, like represented in media, for us to start thinking differently about how we interact with this as well.
Learning by example.
Learning by example,
Yeah.
exactly. I think just normalizing in some capacity or another viewership of this material, conversations around this, and discussion again in safe spaces, right? I don't think all spaces in our life are safe. I don't think we can kind of, wave this like flag in front of some of the more traditional family members. We kind of have to, without some sort of backlash. So we kind of have to see what feels comfortable,
absolutely,
for now, and navigate that space. It doesn't have to be this huge overhaul and this huge change overnight, but just what is like 1% of what I want to do that I can do in this moment.
Right. And it still makes a huge impact, because that 1% will make their own impact, right?
Yeah. Compound interest.
Compound interest, but in a good way.
Yeah.
In the way that you want.
Yeah, exactly. Yeah. I think this is, such an interesting topic that I know we can keep talking about for like days and days and days, for a really long time. But I've really enjoyed our conversation.
It's been fantastic. And I think more conversations like this certainly need to happen. So this is a great start. So thank you so much for having me. It's truly
absolutely. Yeah. Thank you so much for coming on here. This is a topic amongst many that's like very close to my heart. And sort of my hope is to also have a brown sex therapist come online at some point. So I'm trying to find one, and I think I haven't been able to find one, and I think that just kind of goes to show that there is a need. But I would love to continue having more conversations around this, because it's, again, a topic that we don't talk about enough. It's something that we need to think more about, and hopefully our conversation helps someone reflect on their own experience and helps them do things a little bit differently.
Yeah, absolutely.
Yeah, perfect. So we'll have all the resources down below. I think the book that I mentioned, Come As You Are, and I think Dr. Malkani also has some resources to share. Love to hear everyone's thoughts on our conversation. Please let us know in the comment section below, and like and share if this is a topic that really resonates with you and you think there is value here. And stay tuned for our disclaimer. The guest and the host at Brown People Problems do not offer individualized therapeutic or medical advice, and our conversations should not be interpreted as such. This podcast is not a replacement for therapy. This podcast exists for educational purposes only. Please consider your circumstances and engage with the content mindfully.